Welcome everybody to our first panel of the day. So today's session will be focusing on navigating the healthcare system, continuing to advocate for yourself and your loved ones, as well as accessing care. So we will have a couple of pre-recorded talks today from some of our speakers, and then we will have a live panel discussion today with Dr. Gottlieb, who will also be covering for Dr. Kelly. And then we will have a short Q&A at the end of the session to answer any questions. Is the screen showing? Perfect. So I'd like to introduce our first speaker who we'll be hearing from today, Dr. Natasha Chandok, who is a hepatologist and gastroenterologist at William Osler Health System in Brampton, Ontario. She is also adjunct clinical professor of medicine at McMaster University, deputy editor of the Canadian Liver Journal, and is active in clinical teaching and research in liver diseases. Just want to make sure that this is...
Hi, my name is Natasha Chandok. I'm a hepatologist at William Osler Health System. Thank you for inviting me to speak on LIVERight Health Forum. I'd like to talk about early detection and regular testing. The first question I just want to address is the following. Can I recommend a schedule for regular testing and screening that could help in early detection and management of liver disease? So how I would approach this question is, firstly, all of us should be engaged in primary care at varying intervals, but certainly all adults should have periodic physicals to be assessed for screening for various conditions. During these physicals, one would have blood work and vital signs measured, as well as other preventative tests that are conducted at regular intervals. If your primary care provider identifies any abnormal liver tests, this usually would be triggered by perhaps lifestyle interventions, as well as follow-up blood work and liver imaging. If concerning abnormalities are identified, a referral to a specialist in liver diseases or a general gastroenterologist is certainly reasonable. The next question I want to discuss is, how do these recommendations change based on risk factors? So in the world of hepatology, there are certainly well-established risk factors for various chronic liver diseases. These risk factors would include someone's family history, someone's country of birth, usage of alcohol and other illicit substances, other high-risk behaviors like history of incarceration, for example, or intravenous drug use, as well as comorbidities such as diabetes. High-risk patients are more likely to benefit from additional liver testing, and they may also benefit from a referral to a hepatologist, especially if preliminary tests raise any concerns. The next topic I wanted to discuss briefly is understanding and accessing healthcare services. So we'll talk about the following question. Many of us, including myself, find the healthcare system challenging to navigate, with basics for many Canadians, like finding a family doctor, to be a very difficult task. What are my tips for patients trying to understand their liver healthcare options and accessing services that they may need for their liver disease? So I would firstly start off by saying that I cannot express enough how important it is to have a primary care team available to every Canadian to help improve our healthcare and to help provide screening and prevention. Because a lot of recognition of liver disease starts with screening. Many times liver diseases will be silent unless they are very advanced. So it is important that all of us make an effort to try to find a family doctor or a walk-in clinic in our area. If you are having trouble, one strategy may be to connect with friends and neighbors and to check their recommendations. Oftentimes, word of mouth may be helpful to find out a new doctor who may be coming into the area that may be accepting new patients. It may also be useful to contact your local hospital. For example, our hospital often keeps a list of new family doctors in the area, and we can share that with patients. Another potential source could be the Ministry of Health for a list of new doctors in your town. It is also important that we advocate both for ourselves for screening and prevention and for others. And part of what makes us effective advocates is being educated and knowledgeable. So educating yourself on your healthcare issues and learning what you can do to optimize your health from a preventative standpoint will be very helpful. Obviously, we know that the Canadian healthcare system is in a difficult state right now, and it's important that we also feel free to reach out to our local government representatives when we encounter difficulties to try to get assistance at a higher level. It was a pleasure to speak with you, albeit briefly today, and I want to thank the organizers for giving me this opportunity.
Thank you so much to Dr. Chandok for her contributions. I just want to introduce our next virtual speaker, who will be Dr. Mohit Kehar. Dr. Kehar joined the Division of Pediatric Gastroenterology, Hepatology, and Nutrition and is a staff physician as of November 1st, 2020. And Dr. Kehar was born in India, where he completed his pediatrics and pediatric gastroenterology training, and he completed a pediatric gastroenterology, hepatology, and nutrition fellowship at the Hospital for Sick Children. He moved to Queen's University in 2018 as an assistant professor and was the clinical lead of the section of the pediatric gastroenterology before moving to the CHEO. At CHEO, he leads the pediatric fatty liver clinic. His clinical and research interests are pediatric MASLD and hepatology, with a focus on understanding the epidemiology of pediatric liver disease in Canada, as well as raising awareness of pediatric MASLD among other HCPs and community and improve the care of children suffering from liver disease. So I will now have Dr. Kehar's presentation.
Thank you for this opportunity to discuss on overcoming healthcare barriers, a collaborative dialogue. My name is Mohit and I'm one of the assistant professors at University of Ottawa. I'm a pediatric hepatologist and I work at CHEO. And I apologize that I cannot make it for in-person meeting today because of some clinical commitments. I was asked to briefly give opinion on these two brief questions. One was that what measures are being taken to address disparities in liver disease health, particularly for the marginalized communities, and how can patients from these groups advocate for better care and representations, such as virtual care? So to briefly understand, I'll give you a brief overview of what Canadian landscape look like from a liver disease perspective. So chronic liver disease is a silent epidemic which affects 1 in 4 Canadians, and it is one of the top 10 causes of death nationally. Unfortunately, in Canada, there is no national strategies to address chronic liver disease and its increased rates which we are seeing in the past decade or so in comparison to other diseases like diabetes or breast cancer or other conditions. And marginalized community in Canada, such as immigrants, indigenous populations, people who inject drugs, different gender preferences, low income, they often have barriers accessing healthcare services regularly. This is known fact. Last year, our group published how to prioritize liver health in Canada, and we found there were key barriers of affecting management of chronic liver disease in Canada. And there were various factors when it comes to patient factors, care team factors, organization factors, or environmental factors, which are playing a key role in these barriers. From a patient perspective, whether it's a negative influence of social determinants of health and the stigmatization of the chronic liver disease, from a care disease perspective, whether it's uninformed about chronic liver disease management, from a system perspective, whether it's lack of connection and continuity in the different systems, making a multidisciplinary approach quite challenging. And from an environment perspective, the lack of federal control on the provincial healthcare and the lack of prioritization of liver disease in Canada were key barriers that were noticed by our group. So I'll start with what is being currently done from a chronic liver disease perspective space and from a marginalized community angle to that. So currently there are some things that have been done to improve the equitable access of care, not specifically from a chronic liver disease perspective, but as a journal, like things implemented by Toronto Public Health that is in Ontario, like a new immigrant healthcare journey have been started in BC. There are ethnical and linguistic diverse providers who provide services to target ethnic groups. And similarly, interpreter assisted information sessions have been implemented in Alberta to help these marginalized communities, especially immigrants, to understand how Canadian healthcare works. Then there have been a lot of collaborative efforts between healthcare institutions, community organizations, NGOs, and advocacy group to raise awareness on liver health, the risk factors, and what are the resources available in Canada. Some of the examples are Canadian Liver Foundation, which is doing amazing work to increase awareness of liver disease in Canada. Another one of NGO is Fatty Liver Alliance, which is improving the understanding amongst Canadian regarding metabolic associated steatotic liver disease. And then there's growing emphasis on gathering data and conducting research specifically targeting on liver disease in marginalized population like HIV and metabolic dysfunction associated steatotic liver disease, drug use, and HCV. These things are currently being done. From a policy advocacy perspective, there's a lot of push, to change the policy and prioritize liver health in Canada, and there's a lot of advocacy that is going on in this space, including funding allocation that supports initiatives that are aimed to liver disease care, and also specifically on marginalized population. And Canadian Liver Foundation and Canadian Association of Study of Liver Disease is championing this cause. And just last year, we did Parliament Hill Day in April of last year, where I was privileged to be part of this amazing group where we met a lot of MPs and we discussed with them about the importance of liver disease and how to prioritize the care of patients with liver disease in Canada. So now coming to what patients can do for improving advocacy in this space. So there is, patients should also try to engage in these patient advocacy groups. They should join and support these organizations that are advocates of liver health in Canada. And the major point around that is to empower themselves, educate themselves about what liver disease is, what are the condition, what are the risk factors, and what are the healthcare options. And this is very important, specifically from a liver disease perspective, because early stage of liver diseases are pretty much asymptomatic when the patient do not have significant symptoms and they are often missed. And then to provide feedback to healthcare providers and institutions about if there is any discrepancies or disparities that are encountered in the healthcare system so that things can change. And to participate in research studies and trials where patients can contribute to the evidence-based care of liver disease within their communities, and also engaging politically, to engage with policymakers and legislators, to highlight the need of policy change and to promote health equity and to address the disparities which they are feeling are there in the liver disease space. And I was also asked to give some opinion on the virtual care. I'm a huge proponent of virtual care. If it is done correctly, I think it can bridge geographical barriers and improve access to expert consultations in remote areas. So patients can engage with healthcare providers, policymakers to highlight the importance of virtual care and how it can improve and reduce the geographical barriers, specifically from patients who are far from tertiary care centers. And they should advocate for investment into technology and things like broadband access, so that the facilities of virtual care can be given to all the patients, regardless of their locations or their socioeconomic status. Supports the development and expansion of the telehealthcare infrastructure by collaborating with healthcare organizations and policymakers, and to advocate for culturally competent virtual care and also provide their key insight and experiences so that the best practices and guidance can be made and how to best utilize this virtual care for the patients, and advocate for policy changes that promote equitable access to the virtual care services, including reimbursement policies that support healthcare consultation from a liver disease management perspective for physicians. The second question I was asked to give some opinion on is how to deal with insurance challenges, specifically denials. It is, to be frank, quite a common issue which we face, from a pediatric lens perspective, quite often, because many of the medications which we use in pediatric space are also often off-label. So we deal with a lot of insurance denials in our practices. So I'll share some key pointers which patients can do to help prepare themselves for the appeals. So what the patients can do is, firstly, and the very important point, is to understand their policy. They should thoroughly review the policy to understand what services and treatments are covered, and if there is any specific requirements for specific conditions. They should also document each and everything, including copies of denial letters, policy documents, bills, and their health provider notes. They can ask for provider notes from their healthcare physicians, and I'm sure most of us are very happy to provide any documentations to build a strong case. And feel free to consult your healthcare provider, seek their guidance that how to best address that denial and how to have a strong appeal, and then to request a review of the denial. So follow the specific instructions those are provided and submit all the documents and write a well-crafted letter. And please feel free to take help of your healthcare providers. We write an insurance denial letter for a lot of our patients. Um, because specifically there is a lot of data and literature capture that is also sometimes required for these denial letters, so that we can provide all the documentation that is required, and follow up and stay engaged through the process. Follow up periodically with your insurance companies. Maintain a polite but very persistent approach. And if nothing is working, then there is also, you can take legal assistance from healthcare advocates or attorneys who specializes in insurance appeals. And also feel free to discuss any alternative payment options with your healthcare providers. From pediatric space, I can tell that many companies, many medication and drug companies, pharma companies, they also do a lot of compassionate based use for us, for our patients who are having the struggles of insurance denial. So feel free to ask if there is any alternative payment options from your physicians, and stay informed and persist, and stay informed about your rights as a patient and persist in advocating for healthcare services that you need is extremely important. To conclude, I would say that advocacy and awareness are the pathways to closing gaps in liver disease care for all patients, regardless of background and circumstances. And I would like to close here, and if there is any questions, feel free to update the Canadian Liver Foundation group, and I'll be happy to answer them. Thank you very much.
So thank you very much to Dr. Kihar for his contribution. Our panelists were originally going to be Dr. Kelly and Dr. Gottlieb, who we have here today, which we thank you very much for coming. Unfortunately, Dr. Kelly is unable to attend today due to an illness. But we will have a wonderful discussion here with Dr. Gottlieb about the questions that we will be covering about navigating the healthcare system. So I would love to introduce now Dr. Netta Gottlieb, who graduated from Semmelweis University in Budapest, Hungary, and completed her training in internal medicine, gastroenterology, and hepatology in Tel Aviv Medical Center. She completed her transplant hepatology fellowship at Ajmera Transplant Center at the University of Toronto, and she is an assistant professor of medicine at the University of Ottawa since 2021 and has been working as a gastroenterologist, general and transplant hepatologist in the Division of Gastroenterology and Hepatology at the Ottawa Hospital, focusing on liver cirrhosis, portal hypertension, hepatocellular carcinoma, and liver transplantation. As a faculty member at the University of Ottawa, she is highly involved in teaching students, residents, and fellows, and has organized multiple education days discussing advanced liver disease and its implications. So our first question today for Dr. Gottlieb: how can we as patients or caregivers effectively advocate for ourselves or our loved ones to ensure we're receiving the most comprehensive care possible, especially when facing barriers like confusing transplant eligibility or lack of specialist availability?
So I would say that, first of all, social support or family support, not just family, so social support is a substantial part of managing liver disease at any stage. So starting from prevention and the early stages of the disease to prevent complications, and as the disease progresses, of course, the social support is a substantial part of dealing with advanced liver disease. So I think the knowledge or be prepared to what's coming or what do I have is a very important step. And there is lots of information out there. There are many resources that can address any of these questions. The Canadian Liver Foundation has lots of information about all types of liver disease at any stage. There are other tools as well. There are patient support programs, of different diseases like PBC, hepatitis C, and so on. There are different tools, wellness, nutrition tools that can be used. So there's lots of information out there. And we see that when patients and their caregivers are coming prepared to the clinic, to the sessions, then it's very productive.
Absolutely.
And answers your question.
Yes. If someone is confused about lack of specialist availability, how might they be able to go about advocating for themselves in that fashion?
So first of all, as you heard before, consult the primary care physician. They have lots of knowledge for sure, and specialist availability is a problem in Canada for sure. And we're accepting more and more patients. We're trying to be available, and I hope that with time we'll be able to offer more and more space and more time, but it's limited, unfortunately.
It is.
Yeah.
It is.
Maybe virtual care at some point.
Switch the slides then. Perfect. So next question, which is one that I think a lot of people are curious about. We get a lot of questions about this. What advice do you have for preparing for healthcare appointments to ensure productive conversations with healthcare providers, especially regarding treatment plans, testing, or follow-ups that might be needed?
Yeah, so I think it's exactly like I said before, so come prepared. So there's lots of information out there. Make a list of questions, read before the appointment. So most of the people know when they go to see a specialist, so they come to see us, why they were referred to a liver specialist. Most of the time, I would say. So do some reading if it's possible. Do some reading before you see us, because then it will be productive. So read about, the risk factors, what is the diagnosis exactly, what are the options, and then the discussion is better. And what else did you ask me?
If there are any treatment plans, testing, or follow-ups, how to have a productive conversation around certain things
yeah,
like
so
that.
knowledge is the key. So again, many resources out there that can be used. We can also offer them in the clinic. We offer them for different things. Again, for the patient support groups, for example, for alcohol, for addiction resources, nutrition resources, transplant resources for sure, and so on.
Just for my own curiosity, do you feel that it's more helpful when patients come knowing what tests to ask for or knowing what follow-ups to ask for?
Yes, absolutely.
To make it easier for the specialist
Absolutely. We try to be to elaborate as much as possible and to explain as much as possible and to give all the information. But if you come prepared and you know what to ask and what to expect, then I think it's more productive or beneficial.
I'm going to try this one more time just to see if it, no. Unfortunately, our clicker isn't working. But next question is around financial assistance, which is something that we at the Canadian Liver Foundation do get a lot of questions about. So obviously financial barriers can prevent patients from accessing sometimes necessary treatments or medications. So do you have any advice on how to potentially access financial aid or assistance programs that might be more specifically geared towards liver patients? Or are there any other recommendations that you can give for people that might be struggling in those situations?
So, as you mentioned, it's a big problem, and unfortunately, for example, in our in Ottawa, in the Ottawa hospital, unfortunately, in our group, we don't have a social worker, which is extremely important. But there are resources for sure. For example, in hepatitis C, there are resources. In addiction, there are resources. I'm sure you know there are different resources for like ODSB, Trillium, the short and long-term disability treatment plans, disability plans, and so on. For example, we work very closely with the Transplant Center in Toronto. They have a social worker. She gives lots of information. The rail company, for example, they supply they approve free transport between Ottawa and Toronto for transplant or transplant assessment, and so there are resources that we can help with. The rail, yeah.
Wonderful. That's I think very important information for people to know. Some people, may need to look at more advanced treatments in clinical trials. So what should patients know about accessing these advanced treatments or clinical trials for liver disease? What questions should they be asking their healthcare team to understand if these options are right for them?
Yeah, so that's a very important question. I think that, so recently I met a patient, so he sat in front of me and he said, okay, what do I have? Where am I going? So please go back to the beginning and explain everything. So I think this is very important. So we go back from to the basics. We explain. We discussed how it can be preventable. What is the course of the disease? What is the prognosis? What to expect? And then what are the more advanced treatments that we can offer? And we can offer a lot actually. So again, I will go back to the first part, that research or knowledge is the key. But there are many things that we can offer, like, again, yes, clinical trials, access to transplant, post-transplant care, different medications, and access to these treatments, advanced treatments, different procedures. We stay up to date, and we offer them when they're needed, for sure.
Are there any clinical trials at the moment that are active in Canada or the Ottawa area?
So I know in the Ottawa hospital we have few clinical. So of course there are clinical trials for viral hepatitis, hepatitis B, hepatitis D. We have clinical trials in different autoimmune liver diseases, PBC, PSC, if you heard. There are clinical trials in other fields, not in liver, but
Sure.
in gastroenterology. And different clinical trials in microbiome, as Dr. Tan discussed previously. So there are many things, and I think engaging in clinical trials is a very good option for getting treatment and to be involved in advanced care. It's not just getting the treatment, it's being closely followed, which is sometimes very, very important. So being part of a clinical trial can be extremely beneficial, not just for research, but for the patients for sure.
Absolutely. Do you find that those that might have financial difficulties accessing
Yes.
treatments, is clinical trials sometimes a good way for them to go?
Yeah, definitely.
Okay.
Definitely.
Can give them a little bit more access to some of those treatments that
yes.
they're seeking.
Definitely.
I think we're on to our last question, which is a question that I think is very important. So many of us find the healthcare system confusing and difficult to navigate for a lot of people. So even with basics like finding a family doctor, difficult. What are some of your top tips for patients trying to understand the healthcare options and access services that they might need for liver disease?
I think the same answer. So knowledge is the key. Go to different websites, not Google, but the Canadian Foundation, Liver Foundation has lots of information. Other resources, if you don't have a primary care physician, walk-in clinics. Sometimes it's just really basic things that can be managed. And then if more advanced treatment is needed, then we are here.
Wonderful. Thank you so much. So now I want to just move into our Q&A session. So anyone that has any questions for our speakers today is welcome to come up to the mic and ask them. If you have any questions that you think of a little bit later on, you're more than welcome to send us an email about them as well.
Thank you. Really interesting. I'm just wondering, at the Ottawa Hospital, in terms of the resources that you do have available, sort of at different stages in people's journey with liver disease, what resources are available? Let's say when, like there isn't a social worker, but is there a dietitian, for example, when someone has cirrhosis? Or what are things that can be offered?
Yeah, that's a very good point. This is something that we are trying to get for some time now, and I hope that we will get a dietitian, we'll get a social worker. We're working hard on improving these resources. But there are ways other like alternatives. For example, we opened recently a pre-transplant clinic, and we offer a dietitian as a research. It's currently as a research. It's a research clinic or QI clinic, but there is a dietitian available. There are different tests available for assessment of muscle tone and frailty and things like that. We're trying to create a collaboration, for example, for addiction, for patients who are coping with alcoholic liver disease. So we're trying to build a joint clinic with a hepatologist, a social worker, and an addiction specialist who will sit together, because it's not just a liver problem, as you can imagine. So we're trying to overcome the barriers in the resource that we have, but I hope that we will get the resources that you mentioned, the dietitian, the social worker, for sure. It's a substantial part of dealing with advanced liver disease, for sure.
And just to add to that, as a dietitian, I know that the resources for us can be quite limited. Dietitians of Canada does have a Find a Dietitian tool on their website. If you're looking for private dietitian care to help manage your liver disease, that is an option. A lot of it can often be covered by certain work-related benefits or other healthcare
Yeah.
benefits that you might have if you have extended benefits. And they might be able to give you more personalized advice in terms of managing your liver disease based on your own medical history. If you do have generalized health questions related to diet and exercise, though, you can always contact us, and I'd be more than happy to answer them as well.
Yeah, and there is a website that we usually recommend. It's called Wellness Nutrition Tool.
Okay.
Yes, it's talking about nutrition and exercising in cirrhosis or chronic liver disease. It has also it's a very good tool. It can tell you how much exactly you need to eat. There is a calculator, how many proteins, how many calories, and so on. It's a very good thing.
The University of Alberta also has an Empower program focused on those who are living with cirrhosis, and it's about lifestyle management
Yeah.
And lifestyle changes. So that is a free program that they are still taking participants for if anyone living with cirrhosis is at all interested in joining a program like that.
Yep.
All right. Well, thank you so much, Dr. Gottlieb.
My
It's been
pleasure.
such a pleasure to have you.
pleasure.
If anyone has any extra questions, feel free to send them to us.
Thank you.
This is just a small
Thank you,
token
thank
of
you.
our appreciation.